the first couple of weeks of breastfeeding my first, I had a lot of pain. At some points I thought I might have an infection, and I didn't. It was just, you know, it was just pain. It was just painful to start with, and then it eventually subsided, and it was worth it.
Breastfeeding is not supposed to hurt. Pumping is not supposed to hurt. If it does, if it pinches, if it's just even uncomfortable, you should ask for help.
I did call the La Leche League. I called them, I think, twice a week in the beginning, and they gave me a lot of helpful tips and pointers on how for my milk to come in, how to relax, how to drink something while you're breastfeeding. I would have never known that.
I was determined to also breastfeed my twins at the same time, just because I wanted them on the same schedule. So getting them to latch on at the same time was a bit of a challenge, and then it became painful, and then I thought I was doing something wrong. It's really just a process that you have to continue to work through.
It's never too late to get help, but the sooner you get help, the sooner things are going to start getting better for you. Oftentimes moms are just so happy the baby's on that they don't want to break the latch and start again, because like, we finally got the baby on, let's just leave the baby. But if you're in pain, it's not going to work for you, as well as if the latch isn't correct, the baby's probably not getting the most effective milk transfer that they could.
I could tell that when I was comfortable, he was comfortable. When I was tense and uneasy, there was no way he was eating comfortably.
You always want to make sure you're supported when you're breastfeeding, because breastfeeding can last for a longer period of time.
This is a breastfeeding pillow. It's the best thing ever. It helps you to raise your baby a little bit higher, so you don't have to bend over and hunch your back to feed the baby.
Baby stores sell specialty breastfeeding pillows. However, it's not necessary to have one. Simply rolling a blanket up or using a pillow can help support your arm. Feedings in the beginning tend to last for a longer period of time, 10 to 30 or more minutes, sometimes per breast. So holding your baby up here, your arms sometimes starts to get tired, and then your hands start slipping, and then the baby loses their latch. So you want to make sure you're supported so that you're holding the baby up at the height of your breast. Typically, there is no time limit with the baby on the breast. There's very old school thoughts of giving the baby 10 minutes or 15 minutes on each breast. If you think about it logically, if I told you you had 15 minutes to eat, I came up to you at 15 minutes and I took your plate of food away and you were still hungry, you'd be kind of upset and hungry. Okay, if I told you you had to eat for 15 minutes, but at 10 minutes you were full, you kind of feel uncomfortable because you're trying to force feed yourself and you can't do it. So if you follow your baby's cues, you let them stay on the breast as long as they're actively sucking, they fall asleep or they self-detach, or if they're a sleepy baby, you can't stimulate them to go anymore, then you know they're kind of done on that side. You break the latch, sit them up, burp them, wake them up again if you need to, and then put them on the other breast and let them go again. As long as they're actively sucking, they fall asleep or self-detach. If they're still hungry when they come off that second breast, you can offer them a third or a fourth breast. You can switch it, it's okay. Breast milk is produced by supply and demand. Okay, so you need to let your baby do the demanding they need to make the amount of milk they need, and your body will produce it.